Hello, my name is Byron Lee, and thank you for joining me. Over the next few minutes, I will be sharing you simple and practical ways to remain attentive to inclusion in your day-to-day work, even in these unprecedented times. I will begin by exploring why inclusive leadership is more important than ever right now, and then offering a few practical ways to be mindful of inclusion, based upon the good practices I've encountered over the 30 years as an educator and coach, and also based upon the amazing work people are doing right now. So let's begin with a little bit of context. These are in challenging times. And at times like these, leaders will be required to make important decisions, tough decisions. It is also a time for compassion, to recognize the suffering of others, and to do whatever we can to alleviate that suffering. And we are witnessing amazing acts of compassion across the health and social care system right now. Courageous people stepping up to make a real difference. We also know that to create a truly compassionate system of care, we need to ensure that our decisions and acts of compassion are inclusive, that we recognize the diverse needs of the people in need of our care and those of our colleagues too, caring as an act of solidarity. We know people are doing enormous work to save lives, yet with the best will in the world, inequities have the habit of surfacing in the most unwelcome of places. But these things can be remedied. For example, in times of pressure, we naturally place our efforts on doing our best for people we care for based on what we already know, our expert knowledge and experience. But what happens when something is outside of our knowledge and experience? Like knowing how to communicate with someone who's profoundly deaf without access to their usual support, or providing culturally sensitive end-of-life care for someone with an unfamiliar faith. It is in times like these we need to be doing more, not less, to ensure we're being inclusive. To engage with and to listen to those whose expert knowledge and experience will make a real difference. It may even save lives. But how, you may ask, when we're already under pressure, can we be expected to be doing more? Well, there are two very simple leadership practices that can help: resilience and compassion. Two practices that are not only good for inclusion, but are good for the well-being of everyone, including yourself. Less about doing more about doing things well. And here are a few practical tips. Firstly, being resilient. Resilience is about a capacity to positively adapt to life's challenges, both individually and collectively. And being adaptable is a key part of being inclusive. So here are two practical things that you and your organization can do. Be prepared. Getting through this current pandemic will be significantly helped by being well prepared. We can see this in the efforts that are being made to have sufficient intensive care beds for people in need of respiratory support. Applying the same kind of efforts to ensuring we are well prepared to meet the diverse needs of everyone we have will have a significant positive impact. For example, being prepared to support the communication needs of someone who is unable to communicate in spoken English will help to reduce patient anxieties and reduce the pressure on staff who would have otherwise been ill prepared. So as a leader, ask yourself three simple questions. What populations do we serve? What specific needs do they have? And what can we be doing to be well prepared? And in asking yourself these questions, remember, there will be people in your organization and in your community who have the expert knowledge and experience to help you. You are not alone. Be open and flexible. One size doesn't fit all. And being open and flexible will help us respond to the diverse needs of those who we seek to support. This is not always easy when we're under pressure, but our willingness to listen, understand, and change can make all the difference. One less obvious route to being an open and flexible leader is paying attention to your own well-being. Why? Because people under intense pressure and not coping well will tend to react, listen less, control more. So finding ways to boost your well-being will benefit everyone. Unsurprisingly, evidence suggests that people with high levels of well-being are more inclusive. So taking care of yourself is not selfish, it is the opposite. So regularly ask yourself 3 simple questions. What's going to help me feel rested, nourished, and refreshed before work? What concerns do I have? And who is the best person to talk to about them? What can I do to support my well-being whilst at work? Next, we come to compassion. When we see people suffering, it's natural to feel concern. And compassion is a process that transforms that concern into action. And given that compassion is at the heart of health and social care, a compassionate approach to inclusion feels like a very natural way of responding to the needs of everyone. So as a leader, there are several things that you can do to help being compassionate and inclusive. Be attentive to the needs of everyone, paying specific attention to the people and groups who have been overlooked in the past. Be mindful of how bias may be affecting people's feelings of concern for those who are suffering. And if necessary, be an advocate for those whose voices sometimes go unheard. Be curious and seek to understand the needs of people from a place of humility. Act. Compassion is an action, not a sentiment. Action based on truly understanding the needs of others can make all the difference. A simple strategy with a big effect. Finding sustainable ways to lead inclusively during these challenging times would be crucial to the outcome of this pandemic for everyone. And the key message I'd like to leave you with is that by expanding your innate leadership capacity for compassion and resilience, will support practices that are both supportive of others and nourishing for you too.